accidentally press that button again. I am literally holding my phone up to my computer while I talk. So as I get used to doing this, I'm sorry. Sometimes I accidentally press the button. I'll try my best not to. Hopefully this is the last video. Hopefully this is part 3 and there's no part 4, okay? It's a lot of important information still left to give you, so I'm going to keep on going. All right? All right, so the next thing, so when you pour up Elginate, you have to pour it up within 1 hour. So after you take the impression, you cannot let that impression sit out past an hour. If you do that, it's going to dry out. The dimensions of it will change, and then you have to call that patient back to retake the impression, right? You see how that can inconvenience or make the patient very upset. So you just want to be sure that you're responsible about the impression that you just took, or that you just took, and make sure you get it poured up before 1 hour. If you're like slammed and you have a lot to do and you just took an impression, you can always ask one of your coworkers, hey, you know, I have this and that to do. I don't want this to dry out. Do you mind pouring this up for me if you're not busy? Or, you know, you guys can work it out like that. I'm sure the doctor would prefer for you to arrange for someone else to pour up the impression than for it to dry out, right? So always just be responsible in that way and not be afraid to ask an assistant for help, because we are a team, you know, in the office. So just, that's why you build good rapport with your coworkers, and things like that, because y'all will need each other. Trust me, at some point y'all will definitely need each other. Okay, so this is so when the one more thing. After you pour up an impression, you need to wrap that impression in a wet paper napkin, or damp, like a wet paper napkin, but not soaking wet to where water's dripping inside of the impression. Just wet the paper napkin all the way, squeeze it, and then wrap the impression. That just keeps the impression in a cool environment. You never put your impression under running water. That will make it swell, right? It'll absorb all this water and it will swell. And that is called imbition. So you see the first term here, imbition. That's when your impression has taken in so much water, and most of the time it's because the assistant really soaked the paper towel and just let water drain itself into the impression. You don't want to do that. You want to squeeze that paper napkin and wrap it around your impression, okay? So and then syneresis is when it shrinks or dries out. So that's when it evaporates, right? That's when you left it out in the air. You didn't wrap it up. It's been past an hour. So things like that can really mess with your impression. Okay. So it's types of settings. So as you know, in school or in the lab, we always use like the normal set. It's because it's better for practice purposes, because you get a working time of 2 minutes and it takes about 4.5 minutes to set. So you just get longer time to get in the habit of mixing. But I can tell you now for sure, when you get in the office, it's going to be fast set Elginate. And the reason for this is it's very unpleasant for the patient. So they basically want you to be in and out, you know. That's why you have to be really good with your placement and really good with impressions, because you won't have 2 minutes to mix, or 4.5 minutes to allow it to set. When you're using fast set Elginate, you have about 90 seconds to mix that up, and then it sets within 1 minute, 1 to 2 minutes. So you have to mix really quickly, place it, and then be done. You know, we don't use normal set in the office typically, because it just takes too long, and the patient by this time is gagging, right? Having to sit there with this gunky stuff or really thick material in their mouth for 4.5 minutes. So I can tell you now, you'll probably most likely be using fast set Elginate. All right. So basically what is meant by working time is the time you have to mix. The time where you're mixing, putting it in the tray, and then position it into the patient mouth. That's your working time. So all the time used before you actually like sit it comfortably in the, like, I'm sorry, it's late, I'm tired. But so the working time is just the time where you mix and then load it into the tray and then put it in the patient's mouth. And then the setting time is once it's dried and hardened. Okay. Ways you can alter the setting time: use cool water or cold water. That gives you more time. If you use hot water, it speeds up the reaction, and your impression will actually set faster than normal. So you'll never want to use warm or hot water when you're doing impressions. That'll be number 9. Okay. Never use warm or hot water when doing impressions. Okay. Water to powder ratio is usually like 1 to 1. So if you're gonna do 2 scoops, right, you're gonna have to have 2 2 measures of water. So the little cup, as you know, it has 3 lines on it. So when you use 2 scoops, you fill it up to the second line. If you use 3 scoops, you fill it up to the third line. And typically on an adult, if you're taking an impression on the lower quad, the lower arch, you're going to use 2 scoops, right? Because you don't need that much. It's not that big of an area. If you're doing the maxillary or the upper region, you're going to need 3 scoops to 3 measures of water, which means you basically fill up the entire cup because it has 3 lines on it. So you're going to fill it all the way up to the third line with cold water. You're going to mix it real quick and then put it in the patient's mouth. But before you do any of that, make sure you measure that tray in the patient's mouth so it can be a good fit before you mix. And that's what it looks like. All right. Mixing techniques, you basically just manually press the spatula into the bowl, right? And then first what I do is I mix I get all of the powder wet. And I should have did like a little mixing video with pancake mix, but I'm on a diet, so I don't have any pancake mix right now. But I thought that would be a good idea for you guys to practice mixing in under 2 minutes using pancake mix. I don't know. It's up in the air. Tell me what you think about the idea in our lecture discussion. Okay. But yeah. So let's talk about mixing. So once you do your 3 to 3, right? Your 3 scoops of powder to your 3 things of water, and you put it into the bowl. You're gonna make sure all the powder is wet before you start pressing the spatula into the bowl, right? You're gonna mix it up, make sure everything is wet. Once everything is wet, then you can press it into the bowl and mix real fast, press it in the bowl, mix real fast until it gets really smooth and creamy. Okay? And then you're ready to load it into the tray. All right. And then taking an alginate impression is definitely something that you'll do more than your doctor will. They're going to call you to get their impressions most likely. So just be ready to go. Never be nervous. The more you do it, the better you get at it. But if you run from it because it's nervous, it's nervous, but you're nervous, you have your patient, your first time taking an impression on an actual patient outside of your classmates. Sometimes that can be a lot of pressure, but go in with confidence, because if you seem like you're not confident, then the patient won't be confident in you. So just be calm about it and just go for it, All right. So it's saying basically with taking an impression, you have to be good at mixing, loading, and then keeping your patient calm. Keeping your patient calm and comfortable is very important, because if they can sense like a little bit of anxiety or like vibe from you that's not so pleasant, that makes the situation not pleasant altogether. So you just want to make sure you be calm about it. You explain to your patient like, hey, I'm going to load this impression material into the tray, right? I'm going to put it in your mouth. It's going to feel really thick. But if you could do me a favor and wiggle your toes, take deep breaths, and then we can lean you forward if you need to let some spit roll out. But at any moment, please try not to talk. Use gestures to let me know what it is you're trying to say, so we don't have to take this over. Okay, so just kind of explain to them, like, if you're trying to talk to me or, do anything other than allow me to take this impression, then most likely we'll have to do it again. And we want to, make sure you don't have to go through it multiple times. So just in a simple, sweet, professional way, just explain to them like, hey, just wiggle your toes, take deep breaths, relax. We're gonna get through it. It's gonna set really quick, so I need to make sure it's positioned right. Okay, loosen up your jaws. Be ready for me to kind of pull on it, because once you put the impression tray in, remember you have to pull the lip over the tray, right? Because you want it to give it that mold. So just keep all those things in mind. And that's basically, I was explaining the procedures to the patient. You don't want to go in to take an impression and, you don't want to go in to take an impression and your patient not know what to expect. Remember, in dentistry, anything you do to a patient, whether it be adult or a child, you have to explain what you're doing before you do it. That's a part of professionalism. They need to know everything, right? Okay. Okay, and then evaluating the impression. So after you take the impression, right, you always have to go and show your doctor. They have to okay it before you dismiss that patient, right? We don't want your patient to leave. The doctor looks at it. It's a terrible impression, and then they got to call the patient back to the office. No. So you always take it to the doctor to verify. Even if he's in treatment, you don't have to go all the way in the room. You can just say, hey, doc, you know, or get the assistant to get his attention, show him your impression. He'll stop, look at it. Okay. Or no, take it again. So I'm going to say this. Before you go in that room, honestly, to show the doctor, you should honestly know whether it's a good or bad impression. The only way you would go in a room if it's something like really, really small that you feel that may not be a big deal, that's cool. You can go and try and see what he says. But if it's a totally jacked up impression, there's tears in it, all the teeth aren't even on the tray, it's crooked, there's no, you know, if it's just not a good impression or it looks funny to you, take it again before you go in there. Okay. All right. So it says the impression tray should be centered, right? You don't want it crooked. There's complete peripheral roll of the vestibular areas, right? That's when you put the lip over the tray and things like that. That helps with that. Make sure the tray is not over seated. Okay. The impression is free from tears or voids, right? You don't want tears. Sharp anatomic detail of the teeth and soft tissue. And then all the molars are there. You have all your anatomy there showing up on the tray, and then the hard palate and tuberosities are recorded in the maxillary impression. So you just want to make sure that you get a full impression that shows all these things. Okay, so it should look like that. Don't that look good? It's centered. They have the molars on the tray. Notice behind the molars there is a little space. That's what they mean by having the tray be 2 to 3 millimeters beyond, right? The front, the interior part, it's not tearing or anything because there's room here, right? This was a perfect impression. You can just see everything. So you want it to look like this. Now, if your impression doesn't look like this in the office, take it again, please. I don't want you to just bother the doctor behind an impression that don't look good. So it should look something like this, guys. All right. So impressions of edentulous arches. So this patient doesn't have any teeth, right? So when you take their impressions, they don't have any height, so you can use a tray that's not as deep. Okay. And it's important to get like a good impression of the tissues, right? Get detail in the tissues. So that's why the tray needs to be short in order for you to get a good impression of the tissues. Okay. All right. So there's something called a reversible hydrocolloid. That's the one that can change back into a solution after it's changed into a gel. Okay. And then the change in temperature causes the reversible hydrocolloid material to transfer from one physical state to another. And then hysteresis, which is a term used to describe the change in temperature that causes the reversible hydrocolloid material to transfer from one state to another. Okay, so in the reversible hydrocolloid, it is 85% water and 13% agar, which is an organic substance. Write that down. That's always on the test when we go over chapter 46. It's always on the test. So know that the reversible hydrocolloid has 85% water and 13% agar. Okay. All right. When you get in the office, this won't be really important, but it's good to know for background purposes. Okay, gonna skip this slide. Just know that to get this reversible hydrocolloid to change back, they use a specialized conditioning bathe for that. Okay, the temperature takes it back to the solution state. Okay, gonna skip that one. Get that one. All right, elastomeric materials. Okay, so that is going to be the heavy body and light body. Okay, it's used to get an accurate impression. This is what they'll use for final impressions in the crown procedure. Okay, so I think we're on either 10 or 11. What material is used for impressions for the final impression in the crown material? You can put heavy body, light body equals elastomeric material. It's the same thing. So heavy body and light body is considered elastomeric material, and that same material is used to take the final impressions in the crown procedure. It has rubber-like qualities, which is why it's called elastomeric. And it looks like this. This is exactly what a final impression will look like. The blue represents the light body, and then the purple will represent the heavy body. And in the office, this is normally yellow and pink Well, I'm not gonna say normally because I don't want you to go looking for yellow and pink every time because different materials have different colors. But normally, guys, the light body will be yellow. Okay, I've seen that a lot. The light body is normally yellow, and then the heavy body is normally pink. But they're never going to be the same color. When they buy it from the same company, they're always going to make it 2 different colors, so it's easily identifiable on the impression. Okay. So elastomeric materials are self-curing and supplied as a base and a catalyst. So basically, when it's in that not composite gun, when it's in that little, what do you call that? When it's in that little gun that we express it out of, notice that on the tips, it's like it has something in the tip to mix the material for you. So as you're pressing on the gun, the material is mixing its way out. It's like it's mixing together. That's pretty much the base and the catalyst coming together, but it comes out as one out of the two. Okay. So forms of elastomeric, like I said before, there's light body, right? The light body material. You need to know this. Write this down. Light body material is also referred as syringe type or wash type. You will see this on the test. It's going to say which is the wash type material or something like that. You're going to want to know it's light body. Okay. This material is normally applied directly to the tooth. When the doctor's doing the final impression, he normally applies that directly onto the tooth. All right. Then you have your heavy body or your regular body material. It's also referred to as tray type. Hence, that's what you put on the tray while the doctor is putting that onto the tooth. You load the heavy body onto the tray. It's called tray type. Write that down. That will be on the test. It's much thicker than light body, so it pushes that light body into the tooth, and that is what causes it to get that. That's what causes it to get such an accurate impression. Okay, as it says in the third point, it says their stiffness helps force the light body material into the close contact with the prepared tooth and surrounding tissues to ensure a more accurate impression. So that hard material pushes that light body into the tooth surfaces and tissues, and it allows you to get a good impression, an accurate impression. Okay. And I've already stated this is going to show you the technique, or this slide is about the technique. Just know that the dentist is going to be the one with the light body. Write this down. The dentist will have the light body when taking the final impression. The dentist will have the light body, and the light body goes directly onto the tooth. Write that down. The dentist will have the light body, the gun with the light body, and he will put the light body directly onto the tooth. Okay. The dental assistant will have the heavy body, okay, and the dental assistant will load the heavy body directly into the tray. You need to know that. You need to know that. Write that down. So that the dental assistant will have the heavy body, and the dental assistant will load that heavy body into a tray for the doctor on both sides of the quad tray. And then the dentist will have the light body, and he will apply the light body directly onto the tooth when you're taking that impression. Once he's done applying the light body, he's going to put his hand out, and he's going to want you to give him the tray with the heavy body. And then he's going to place the tray with the heavy body into the mouth to take that final impression. Once the impression is done, it needs to be disinfected. You can use the spray bottles located in the office to spray that material. It's different from alginate, so if you spray it, it doesn't get big or anything like that. Okay, then you place it in a biohazard bag, or a Ziploc bag sometimes is what is used, and then you send it to the lab so they can create the final crown. Okay, so we're talking about the final impression here. Remember, the final impression is what goes to the lab. All right, so there's 3 stages of curing with elastomeric material. It is initial set, final set, and final cure. Okay. So the elasto material comes in many different ways. It can be in paste form, auto mix system, which is kind of what we use in the office, mixing unit system, or the putty system. Okay, I'm not going to talk about the systems. You guys can read over that in your textbook. Okay, We're also not going to talk about the types of elastomeric material, the types that I wanted you to know we just discussed, the heavy body and light body. That's what you're going to see when you get to the office. All right. Let's see. What about that? All right. So occlusal bite registration. So the occlusal registration is an accurate impression of the normal centric relationship of maxillary and mandibular arches, also commonly referred to as the bite registration. So I think we're on like number 12. Make sure you put that occlusal bite is also known as the bite registration. And it just takes an impression of how that patient occludes or bites down. And it looks like this. So when the doctor actually take a bite registration, this is what it will look like. You just express the bite registration material onto the quadrant or the tooth and have the patient bite together, and it'll take something like this. And I believe it takes about 60 seconds. So it's really quick to dry. Okay, that is the wax bite registration. A lot of times when they're doing dentures, they'll take the wax bite registration. So the regular bite registration that we just saw is used for like crowns, and then the wax bite registration will be used for like dentures. Okay, see how it gets the whole arch, the bite of the patient's bite within the whole arch. Okay. All right, so if you guys have any questions, go ahead and submit it into our discussion. The name of the discussion will be Chapter 46, Lecture Discussion. Remember to load all your questions into that assignment, and then you guys can chat and ask any questions that you like with that, and I'll be a part of that discussion. Thank you. Bye.